Welcome to the office.
How you doing?
Good, how are you?
Welcome to the office.
It's good to be here.
What brings you here? How can I help you?
Um,
What's going on? Why did Mama finally get you in here and your sister finally get you in here?
because I feel like it was time for me to see a chiropractor again. Just because it's been years since I've been to one. The last time that I vividly remember going to a chiropractor was because I don't remember when I was, but I had like severe lower back pain.
Okay.
And at least at the time, what was identified was that my legs were different legs.
Okay.
I think back then it was like
Based on an X-ray?
Yeah, yes, and like putting them side by side, you can tell that there's a difference.
Okay.
And so, yeah, it was like it was it was really bad, like lower back pain. I don't remember how old I was. It was definitely.
How old was he, Mom?
How old is he?
How old was he?
Back then.
15?
Yeah, you were in high school.
Yeah.
Yeah, you were in high school, like 15, 16,
Okay.
when we went there.
Okay.
You were doing marching band.
That's probably why it
Yeah.
came to be that. I don't know. Anyway, so yeah,
Okay. What instrument did you play?
I played baritone saxophone.
Baritone sax. All right, the
Yeah.
big boy.
It's
The
the
largest
big
one you can march. Yeah.
All right, all right, cool. So you had some imbalance in your pelvis. You saw a chiropractor for some treatment. You had back pain.
Yeah.
That was back in high school.
Yeah.
Fast forward 10 years later. What's going on?
I think occasionally I find myself like I don't know, waking up with lower back pain as well. But
Every day?
Not every day. It's like occasionally, definitely significant amount during the week.
Okay. So in your previous treatments that you've had, did you ever have any x-rays taken?
Yes.
Okay. And how long ago?
That was probably back 10 years ago.
Okay. And did they see anything? Was anything seen back then in terms of imbalances?
Yeah, the tilted pelvis still, it was an inch difference,
Okay.
both on the x-ray and you can see it when my legs are straight.
Okay.
And I was adjusted, so the difference was half an inch, I believe.
Okay. Good.
But it stayed like that.
Okay. Fair enough. All right. So we have the low back, number one. Do we have any shooting pains?
No shooting pains.
Okay. Anything else going on?
Occasionally, I guess it's mid back as well.
Okay.
I find myself trying to like, I don't know, feel like something's out of place or just trying to like, I don't know, just stretch it out.
The right side?
It's like, it's in the, yes, to the right.
Right side.
Yeah.
Okay. So what we're gonna do is let's go over your x-rays.
Mhm.
Let's figure out what's going on. We'll do the exam and we'll figure out where we're gonna start.
Okay.
Okay?
Yeah,
Along
sounds
the
good.
way, you have any questions, you ask. If you're uncomfortable with anything, tell me to stop.
Okay.
All right? You
Yeah.
ready to start the journey?
I am.
Let's do it. I want to do a posture line first on the lateral film. And if we run the line from L5 straight up, the first thing we see is that it's just the neck is slightly behind the foundation, okay? So that can contribute to a little bit of upper neck and shoulder tightness or stiffness, but we'll get to that x-ray in more detail. Let's go to this x-ray here and let's talk about what's going on here. And let's see, do we have a level base and foundation? Not really. And we can see it right off the bat that the sacrum is tilted on this right side. And before I go to the numbers, I want to point out a couple of things here, okay? So the right leg is shorter than the left. We can see that the tailbone is bent or tilted to that right side as well. But here's an interesting finding of how the body compensated to stabilize. And what it did was, I'm looking at the transverse processes of L5. So if we look here, this is the left transverse of L5. But if we look over here, look at it. That's a big one.
Yeah.
The thing that's throwing me off is this, okay? You see this space in here?
Mm-hmm.
This is what's throwing me off. Look, L5, this should all be one bone. It's almost like there's a lucency, and I have to look at the lateral to see. But what your body has done to stabilize, it has hypertrophied the right transverse process of L5 to stabilize your side. Look at this. This is pretty interesting. if the foundation is like this, okay, look, watch this. This is actually kind of cool.
Yeah.
The human body. Look at what the human body has done, guys. This is really cool. Look, so it should be tilting like this, and there should be a gnarly curve. But what his body did was it hypertrophied the right transverse in order to kind of stabilize the L5, so his spine is not leaning all the way. That's actually pretty cool, dude. That's a first. That's a first. That's actually a first, guys. Okay, you see what I'm showing you?
Yeah.
And then if you go to 4, it's a regular transverse again. But here's what's getting me. Why is there a space there? It's almost like a fracture, but it's not. I don't know. Let's take a look and let's go deeper. You injured yourself, didn't you? He's had a couple of major injuries. What'd you do?
Nothing comes to mind right now. I do vividly remember actually when I was studying, when I was at university in St. Louis.
Yeah.
It snowed, and so it gets icy, and so I do remember falling, but not that bad. But
You have actually an old pars fracture.
oh.
And
wow.
yeah, you have an old pars fracture creating a spondylo, a slight spondy. Interesting. Huh, okay. This is going to be a fun case, guys. I'm actually just amazed at what the body did here. Because if we look at this, sorry I keep going back to this, but it's throwing me off because look, it almost looks like this is 5 and this is 4. It looks like they're 2 different bones, but they're one.
Oh.
You see what I'm saying?
I see that, yeah.
Because look, this is one vertebrae here. That's just throwing me off, dude. It's so cool. This thing is broken, dude. You see how this bone, it all comes into one piece here?
Oh, yeah.
You see what I'm showing you now? So this is a pseudospondy L5. 4 is tilting back, 3 is tilting back, 2 is tilting back, 1 is tilting back. And then he curves early like he's a motorcycle rider. You don't ride motorcycles, do you?
No, I don't.
Okay, I'm just asking, dude, sorry. I'm just asking. Okay, so we'll keep that on. Okay, let's go back to this. That was a cool, this is actually a cool case. In terms of when I say cool, it's not cool, but it's cool. It's just cool that there's something new. Let's go to the numbers and see. Okay. So here's what's going on. We have PI3, IN4 on the left side. We have a 10 millimeter drop of the sacrum on the right, but we have a 1 millimeter rotation on the left. We have a measured difference of 15 millimeters of the right pelvis compared to the left, and correcting the left pelvis will only fix it an inch, so that's not the answer. Let's put this together. The left pelvis goes down and turns in meaning this way. The sacrum goes back a tiny bit on that left side, but it drops down. And that's the disconnect. So the idea, or what we really have to figure out with you and get this sorted out, is we need to get this under 7.
Mm-hmm.
And if we get it under 7, everything's good, life is good, okay? I'm going to be working a lot on your tailbone, on your sacrum. And it's whatever your body's going to allow to happen. But it took years to get that hypertrophy.
Oh, of course.
Okay?
Yeah, that's new bone growth, yeah.
It took a while to get like that. So the idea is we're going to start to work, but here's what will happen when I do that. I want to be very clear. If and when we start to do that, it's not going to feel comfortable here.
Mm-mm.
Because it did that for a reason. So if we take the reason away, then it has to refigure it out.
Mm-hmm.
So you may go through some interesting changes, for lack of a better term, until it finds its balance. Okay? Does that make sense?
Yeah.
So the right pelvis goes down, we have a slight right curve, it balances out, and then right in the upper mid back here, that's your digestion. Because when I look at his digestion, I don't see the Megan Blasi the way I want to see it. And that's not just going to party one day or a weekend, sorry. You've had this for a bit. This little dark bubble here is supposed to be a big half black circle, and then we have all this undigested food going on in the gut. The control of that is around the mid back area between the shoulder blades, T6 area, around this area, and you can see there's something going on here, okay? I'm going to zoom in so you can see better. Yeah, so look at this. So from here, it starts right here. This tilts up a little, and then this tilts more. And you can see there's a concavity to the shape. Something happened, he had some compression injury there. Whatever that is. Number 1, 2, 3. T3, T4, T5. T6 is where it's starting, this curve. And T6 is that major nerve to the stomach, okay? Between the shoulder blades, and that's what's throwing your neck off. Because what it's doing is this. It's curving from the bottom here the whole way this way. Do you see that?
I do, yeah.
And then what the body is doing up here is, it's coming back to neutral. Your upper cervical is good, meaning the capsules are good there. Okay. Now let's look at the side profile. Let's give you good news and whatever else there is there. So when we're looking at the foundation, the upper body is slightly behind. The good news is your discs are good overall. The discs are good. It's that 5 we need to figure out. 4 is. Here's the other part of the puzzle. 5 is good, but it's tilting. 4 is tilting. 3 is tilting. 2 is tilting. 1 is tilting. 12, 11, all the way to 10. 10 comes back to level. So everything from low back, sacrum, all the way to T10 is compensating, okay, for that foundation. The discs are still good. The discs are all good. You're young enough. Discs are good. You have a little bit of a straight neck going on there, okay? You had a whiplash injury, I'm assuming?
Not really like a severe. I mean, I feel like I haven't been in like a. I mean, it could be any injury like that.
Okay.
No car crash comes to mind like that.
Okay. Sacks?
Yeah, probably marching for 4 years with because we didn't use harnesses, we used neck straps.
Oh wow.
Yeah.
So check this out. This is your neutral X-ray. This is you in extension. This is where we get the answer. You see your neck doesn't bend forward everywhere. And this goes forward, this goes forward, that goes forward, that. This one didn't move, and neither did this. So we have an issue at C6, C7. We have an issue at T6 area, and we have the foundation. Those are the majors I'm seeing based on your film.
Yeah.
Looking at the other part of this foundation, I'm not too excited about this right now. Okay? Right now our focus is the tailbone. Does that make sense?
It does. Yeah.
Questions on the x-rays?
Not right now.
Yeah, you got that chino wiggle. You just keep walking in the circle.
Okay.
Now what's interesting when you look at him, you can't tell there's that short of a leg. I mean, you're a tall guy too. Okay?
Yeah.
So you've held pretty well. But you can see the wiggle. You can see how he wiggles side to side. The other thing you can see, turn around please, step back. This is all swelling. He's got a lot of swelling in his tailbone. So this is all swelling. And I would expect to see a little more of the dimples here. That's what I want to see for you, okay? And then so this is what we're seeing is this is kind of straight, and then this is flat. You need more curve in here. This is called dishing of the spine. And that usually comes from T6, T7 area, which is what we found. All right, starting at the base of the neck. C6, right side, 15 points. C6, C7, 15 points. Do 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 do. All right. So what's interesting here, it looks like it's going right, but we do it a few times, it's now going to go left. So his right side is compensating a lot. And there it is, T6, T7, 5 points. So you know that kink I was showing you up here?
Mm-hmm.
This is all compensating these muscles
Mm-hmm.
for what's going on here, which goes back to your dishing that we were talking about. And I'm not talking about, because someone's going to make this comment, I'm not talking about dishing in radiology. That's diffuse idiopathic skeletal exostosis. Dish. I'm not talking about that dish. I'm talking about dishing. We call it dishing of the spine. It's flat. It's like a dish. It's not rounding. It's not the DISH acronym. I had to just be clear about that. Sorry, diffuse idiopathic skeletal hyperexostosis. H. I forgot the H. Senor,
Yeah.
15 points down low. Am I boring you?
No, you're not.
Are you sure?
Yeah.
15 points. I got S4. We got T7. We got C7. Feet together, sir. Slide forward a tiny bit. Open and close your knees with your feet touching. Good. Open and close. Right side only, please. Left side only. I mean, they both don't move. Right side, left. Scoot back. All right, we got to fix this chino wiggle. I fixed your chino wiggle. Número 5, ¿duele? Pain? Sí.
Yeah, it does.
Número 1, poco.
Yeah.
2, 3, 4 or 3.
Okay.
4,
Yeah.
5,
No.
4.
Yeah,
Chihuahua. 1, 2, 3, 4, 5, 6, 7. Duele. More pain at 6,
No.
more pain at 7.
Oh, yeah.
7, S4. Yeah, it's coming together. 7. Ay, 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 ay. 7, 7, and S4. That's where we're going to start. So, let's formulate our game plan, sir.
Okay.
We're going to do the sacrum on the high-low. After the sacrum, I'm going to have you walk, and then we'll do the rest.
Okay.
Okay? You ready for me?
Yeah.
Ruby! Wait a second. Where's Shasha?
Oh no.
Where's Shasha, guys? Oh my God. Shasha! Ruby! Hello? Where's Shasha? Guys, Shasha took off. She played hooky. So we got a substitute. Come on, Ruby. Hi, Ruby.
Hi.
Some people may know. If you guys know who she is, leave a comment. We're trying to have a little fun, Ivan. You know life is so serious.
Yeah, it is. I can
Life
fire
is too
it.
serious. Let's go face down. You're ready, right?
Yes.
Jokes aside. Let's go. So, we are on S4. We want to torque it counterclockwise this way. Everyone's like, what is he actually doing? There you go. Good. You got him? Home run. Nice. Next, I'm going to do your 7. Relax.
Necks and shoulders.
Gotcha. Thank you, Ruby. Senor.
Yeah.
I gotcha. Come off slowly, and let's walk that off, please. Take your time. Give me some feedback. Diferente.
Yeah.
Sí. Qué diferente.
I think the middle back hurt more. I don't know.
And what's different right now
When you work.
you work?
Let's look. It feels more natural.
Let's look and see if we got that wiggle still.
Okay.
Ah, all right, guys. Well, the first thing we can see is there's less swelling. And look, you're starting to see the dimples here. Walk. Aha! No more chino wiggle. You see it, Mama? So now they're moving up and down properly. Very nice. Have a seat, please. Let's take a look. Starting at the base. We're going to continue on that 7. T7 is clear. Sacrum is clear. Let's do C7. Sit back for me, please. Left ear, chin down a little. Feet out, rested on your heels. Good. There it is. Ah, gotcha. Oh my baby. Walk it off. I haven't got his groove back.
Oh, definitely.
Back over here and have a seat, please. Very nice. Scoot forward a little bit. Feet together, open and close your knees, open and close. Good. Right side only. Hand. Left side only. Hand. Sit back for me, please. Check it out. Back towards me. 5. Lean with your back, not your hip, please.
Oh.
Come back slowly. Mira. 5. 1. 2. Bueno.
Yeah.
3. 4. Pretty good, huh?
Yeah.
Very nice. Let's check up top. On the neck, sit back for me, please. Let's check the movement. Ah. Bueno. All right. Sit up straight. Now you're going to get the buff and polish. You know what's really cool? If you look from up here, I'm just looking from up here, you can actually start to see the dimples coming. And you can see the swelling is already more than half down. That's really cool. Pretty cool. Why take you so long to come see me?
Oh,
Life?
yeah.
So, be mindful of your intention.
Mm-hmm.
Very mindful. You know what I'm saying?
Oh, yeah.
Don't worry, he just started with me. It's day 1. It's day 1. He just started with me. Sit up and turn, please. But I encourage you, I have to look over your x-rays and ask me questions, dude. You know, whether it's structure, whether it's function. You know, this Gonstead work is based on, he used two main resources when he was trying to figure out a case.
Mm-hmm.
Guess what 2 books? Guyton's Physiology, you remember that one? I don't know what.
We use it. Yeah. I think.
Guyton's Medical Physiology was the book that we all studied from.
Okay.
I don't know if the authors have changed now. And Gray's Anatomy.
Oh, okay.
So the idea is whatever the condition is, let's look at the anatomy first. And let's look at all the nerves and blood vessels surrounding that particular organ. Then let's go to the physiology and determine what's off. Because it's either up or down. Is it sympathetic or parasympathetic?
Oh, yeah.
And then we need to look at, do we need to slow down the sympathetics or do we need to speed up the parasympathetics? Or do we actually need to do both? Because what if you have somebody, as an example, that has a tachycardia? Now we don't get fancy. You got a tachycardia with mid-back pain. You found an atlas and you found a T5. What do you do? That's the question. This is the beauty of this work. So what would you want to do? If we adjust, or let's say it's a T4 and an atlas, and you have to adjust both, but the patient has a history of tachycardia. Tachycardia means what?
Which is elevated heart.
Elevated heart rate, which is a sympathetic response. Sympathetic nerves are here, heart and lung. Parasympathetic is slowed down. So in that case, we do what? We would do the sympathetics first, and then the parasympathetics, so they don't leave with tachycardia. You get it? What if it's bradycardia? Bradycardia means?
Low
heart rate. So in that case, we do the opposite. We would do the atlas first and end with the sympathetic. So they don't leave with the
bradycardia.
Correct. You see? It's kind of cool stuff, too. I'm just getting started, lady. That's the stuff I love about the Gonstead work. Okay? Squeeze. Squeeze. You trying to be a surgeon? You trying to be a surgeon?
Yeah.
What kind of surgeon?
I'm interested in like obstetrics and gynecology, so but I can.
But that's cool. Oh, squeeze. Squeeze. Lunate. Alright, jokes aside. Any questions? Do you understand what I found?
Yes, I
You
do.
understand what I found?
Yeah.
Okay. As you do 2 more walks for me and let me know if anything is different for you after all that fun stuff. A little bit easier.
Yeah, no, it definitely is. I don't. Yeah.
So your homework is very simple. Your homework is water, walking, and ice.
Water walking?
Water, walking.
Oh.
And ice. Water, walking. Yeah, we work on water too. Water, drinking about 3 to 4 liters a day. Ice the areas. Ice the areas that we adjusted. There may be some soreness. And walking, your goal is 10,000 steps.
Okay.
All right. Questions?
No.
All right. Welcome to the office.
You're a thorough speaker. Thank you.